Hi, my name is Hunter, and today I will be performing administration of a subcutaneous injection. So for getting started, I have my school badge, scrubs. I don't have any polish, don't have any jewelry. So the first step in administration of this skill is gathering our supplies. So I've got my medication vial, I have my gloves, I've got two alcohol swabs, I've got gauze pads, and then I've got my my syringe. Now, when we are administering a subcutaneous, we want to make sure that we are choosing a 1 to 3 ml syringe, 25 to 27 gauge needle, 3/8 to 5/8 inches. But this is what I will be using for the injection for supply, because that's what I got for supplies. So after we have gathered our supplies, whether we need band-aids and or anything in addition to that, but for this is what we'll be using. And then we've got our patient here. So first we want to verify the prescriber's order, always starting with that. And then we also want to verify the 6 rights of medication. So right patient, right drug, right dose, right route, right time, and then right documentation. And then after that, we want to go ahead and check we want to verify the medication to the EHR/MR, and then calculate the dose for this. For this skills, it's going to be heparin 1,000 units, subcutaneous, 1 dose. I did do a calculation on sticky note, so I do formula method. So we've got the desired is 1,000 units over 10,000 units times 10 ml gives us 1 ml of heparin. Nothing on the back. So we will go ahead and take our supplies, go into the patient's room, knock on the patient's door, shut the door behind us to ensure patient privacy, introduce ourselves to the patient. And in doing this, we would be, obviously performing our hand hygiene. Hi, Mrs. Smith. My name is Hunter. I will be your nurse today. After that, we would then want to identify the patient using 2 identifiers. Can you go ahead and state your first and last name and your date of birth? Okay, great. And then after that, we want to ask the patient if they have any allergies. Brightness is really down. Mrs. Smith, do you have any allergies? That's like too bright. No? Okay, great. So after that, we would then want to inform the patient of the, what our visit was for. So we would let the patient know, Mrs. Smith, your provider has ordered a injection for heparin, and I'll talk with you a little bit about the mechanism, the use, and side effects and adverse effects. So after we after we tell them about our visit, we certainly want to inform the patient the purpose of it. So the heparin injection is going to be it's an anticoagulant to help with blood clotting. It can be commonly used in surgery and or DVTs. Common side effects are going to be bruising, bleeding. You might be at an increased risk of bleeding, or if you cut or scrape yourself, you might notice that you bleed a little bit more, or you have a slower time clotting. And then adverse effects, these are ones that we absolutely don't want to happen. Now, if it is to happen, you need to let us know as soon as possible so we can notify the healthcare provider and address it. Any abdominal pain, blood in your urine, or coughing up any blood. So if those are to occur, please let us know as soon as possible. And then after we discuss the medication with the patient, when we talk about side effects and or adverse effects, we want to allow the patient to ask questions, or allow them to feel comfortable asking questions. So, do you have any questions, Mrs. Smith? Mrs. Smith? No? Okay, great. So we will then go ahead and go into drawing up the medication. So first of all, we want to, before we do that, we'll go ahead and perform our hand hygiene. We'll apply our gloves, and then we will go into administering the medication. So, in administering the medication, we would then want to, again, verify the medication and make sure, verify it against the MAR. Right, so in drawing up the medication, when we draw it up, we are going to first start by alcohol swabbing the top of the vial here. Okay. So first, before we administer the as we draw up the medication, sorry, I want to get it in like view. What we're going to do is we're going to again verify the medication, the dosage, which is going to be 1 ml, and so we will, with the cap on, we're going to pull back the plunger to 1 ml. Excuse me. Okay. And we're going to administer air into the vial, the 1 ml. Kind of see that. Yep. Okay. So we're going to go ahead and we're going to inject the air into the vial. And as we do this, we are going to invert the medication, and then we are going to invert the medication. Sorry, we're going to insert this, insert the air, and then we're going to invert the medication and withdraw the 1 ml. As we are doing this, we want to watch for any air bubbles and make sure that we get out any air bubbles as we pull the medication. So that would look like tapping the syringe to move the air bubbles back and forth, and or pushing the plunger back and up and down back into the vial to get any of these air bubbles out. So after we do that, we're going to go ahead and remove the syringe. We're going to recap the syringe. I guess I'll just start doing it. So we are going to insert the air. Okay, administer the air. Let me make sure I got it on camera. We're going to invert. There was a little air bubble, but we pushed it back in and pulled the plunger. Okay, and in a real life scenario, we more than likely would not recap the medication, but in this case we are, because we have to inspect and pick an appropriate site for the patient. So we're going to go ahead and recap it, show you. Okay. Yep. Let's see. 1 ml. So we're going to go ahead and recap it, and in this we're also going to verbalize and make sure that the medication dose is correct, and we've got 1 ml of heparin. So we're going to go ahead and set this here for now with our gauze. I'm going to put this over here. We would be disposing of our trash. Okay. So then from here, what we're going to do is we're going to select an appropriate site for the patient's heparin injection. And as we get this into site here. Okay. So in selecting an appropriate site for the patient, we want to, so there's 3 sites that we can inject for subcutaneous. So So we want to, as we do this, we want to inspect the skin for any bruising, inflammation, edema. We want to palpate and make sure that there isn't any masses and or any complaint of pain, right? And so what we'll do is we are going to select an appropriate site. We're actually going to do the abdominal as one of the locations that are appropriate for subcutaneous injections, but we want to make sure we're doing it the appropriate length away from the belly button. And so as we do that, we're going to, so we would select the site, we would palpate, make sure that there isn't any pain or masses, right? Okay, and then we would want to make sure that the needle is the correct size for the depth of the skin, right? So we would measure from top to bottom to make sure that the needle is 1/2 inch, 1/2 of the length of the fold. Okay, so we've done that. Okay, so that's been verified. Okay, so then from here, what we want to do is we want to go ahead and we want to clean the area and prep it for administration, right? So we will go ahead and get our other alcohol wipe and we're going to clean. And we're going to start at the injection site and we're going to work our way out 2 inches from the administration site. So we'll go ahead and we want to start in the middle and work our way out, like I said, 2 inches. Okay, we would dispose of that, and then we're going to go ahead and let this area dry. We do not want to blow on it or put any of our germs back on that. So we just let it dry. We do not touch the site once it's cleansed. Now, if we were to, we would definitely want to use another antiseptic wipe and make sure that we're using our aseptic technique. So now we will move into the actual administration of the injection. So what we're going to do is we're going to hold the syringe between our thumb and our forefinger like a dart. We're going to hold the skin, okay, pinch it, right, around the site of injection with our non-dominant hand, but obviously I have to take the cap off. So what we're going to do is we're going to hold the syringe, thumb and finger like a dart, and then we're going to pinch the skin, okay, and then we're going to inject the needle quickly and firmly at a 45 to 90 degree angle, and then once we are in, we're going to go ahead and release the skin, and then we're going to withdraw the needle quickly. So yeah, let me just walk you through. So we're going to go 45 to 90 degree angle. Okay. Okay. And now we're going to release the skin. And we're going to take, again, our non-dominant hand and we're going to hold down here. And then we are going to slowly administer the medication. Okay. And we're going to want to do this over a course of several seconds. Okay. You doing okay? All right, great. Patient's doing okay. Okay, and then after we have it administered, we're going to withdraw the needle quickly, and we are going to place the gauze gently over the injection site. Okay, right, and then we are going to immediately dispose of this. We never want to recap a needle. We're going to immediately dispose of this in a sharps container, and we are going to gently place the gauze pad over the injection site. We're never going to massage it. We would apply bandage if appropriate and as needed. So from there, what we will do is we will go ahead and make sure the patient's okay. They did well. She is doing fantastic. After that, we will go ahead and we will remove our gloves. We will perform our hand hygiene, and then we would document our procedure.